Paul infected Jan, Jan could infect Mo, who could infect a lot of people. But wait, they all have the COVID Alert app. So Paul tested positive and entered a code in his app which anonymously alerted Jan, so Jan stayed home and Mo went to work safely. Phew, close call. Help break the chain of infection. A message from the Government of Canada. This is Jan. Jan sometimes visits her neighbor Paul. Paul has COVID-19, but doesn't know it. Jan also takes the bus. So does Mo, who's a frontline worker. So if Paul infected Jan, Jan could infect Mo, who could infect a lot of people. But wait, they all have the COVID Alert app. So Paul tested positive and entered a code in his app which anonymously alerted Jan, so Jan stayed home and Mo went to work safely. Phew, close call. Help break the chain of infection. A message from the Government of Canada. This is Jan. Jan sometimes visits her neighbor Paul. Paul has COVID-19, but doesn't know it. Jan also takes the bus. So does Mo, who's a frontline worker. So if Paul infected Jan, Jan could infect Mo, who could infect a lot of people. But wait, they all have the COVID Alert app. So Paul tested positive and entered a code in his app which anonymously alerted Jan, so Jan stayed home and Mo went to work safely. Phew, close call. Help break the chain of infection. A message from the Government of Canada.
Good afternoon, everyone. Thank you for joining us for the Government of Newfoundland and Labrador's COVID-19 update for today, Friday, February the 12th. I just want to address the uneasiness, tension, and fear that we are all feeling right now. I see it in the faces of everyone around me. I hear it in the voices of those asking if and when things will be okay. They're asking because their kids or have an at-risk loved one. They're asking because of their relatives in long-term care. They are wondering when the somewhat normal we've enjoyed these last few months will be back. Going home last night, I thought long and hard about what I'd tell my own wife, Allison, and our kids. As a parent, I believe you have to balance comfort with reality. And I told them that we've been down this road before, and it's up to all of us to fight our way back. The image of Eastern Health staff bundled up against the cold, diligently doing their jobs, administering COVID tests as a line of cars stretched on, really stuck with me. Right there, though, that is the spirit of this place we love. Thanks to you and everyone on the front lines. I know you all have COVID fatigue, but right now we must dig deeper and fight harder. We have taken appropriate steps with closures and will bring it in more restrictions if necessary. But I ask you all to please do your part too. Keep fighting. Listen to the advice of Dr. Fitzgerald, who's doing such an amazing job here, going above and beyond every single day to keep us all safe. So please double your own efforts. Get tested if you have symptoms. Safely check in with your neighbors or anyone who might be struggling. I saw a great post the other day. It said, "Let kindness be the only thing that spreads." With that, I'll turn it over to Dr. Fitzgerald for today's update.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us today. Since the media briefing yesterday, we have 50 new confirmed cases of COVID-19 in our province. 47 cases are in Eastern Health, 20 are under 20 years of age, 4 are between 20 and 39 years of age, 16 are between 40 and 49 years of age, 3 are between 50 and 59 years of age, 2 are between 60 and 69, and 2 are over the age of 70. 3 cases are in Central Health, 2 between the ages of 20 and 39, and 1 between the ages of 50 and 59. The total number of cases in our province is 660. There have been no new recoveries since yesterday, leaving 260 active cases in the province. 1,560 people have been tested since yesterday for a total of 87,447 individuals tested to date. As we expected, we are starting to find cases outside of the metro area spreading through the Avalon and beyond into other regions of the province. And so no matter where you live in Newfoundland and Labrador, you need to get tested, even if you have one symptom of COVID, or if you've been identified as a contact of a case. We have several contacts identified associated with long-term care and personal care home facilities in the metro area. To protect those most vulnerable to the severe effects of COVID, I will be introducing or amending my special measures order from earlier in the week to further reduce visiting to all long-term care, personal care homes and assisted living facilities to only those visitors who are deemed essential for the health and care of the residents. I hope these measures will be short-lived to minimize negative consequences, but I feel it is important for us to do it at this time. As a result of contact tracing, there are significant and growing numbers of families and businesses that have been potentially exposed to COVID. And while it is impossible to determine a firm number, we estimate that there are thousands of individuals in the metro area that have been directed to self-isolate. We know that people have many questions and concerns. The situation is rapidly evolving, and we ask you to have patience as Eastern Health identifies cases and works through its investigation. For now, if in doubt over whether you have been exposed to COVID, the safest thing for you to do is to self-isolate and to listen to public health advice. Please do not go to your local emergency department unless you require urgent or emergency care. If you enter a healthcare facility with minor ailments, you could be increasing the risk of exposure to COVID for essential healthcare workers and medically vulnerable individuals. If you have had a COVID test and are looking for your results, you should use our website to check. The website will have the most current information, and you should only call 811 for your test result if you do not have internet access or a valid MCP number. It can take up to 72 hours for your test results to be available. We also ask any residents of the province without an MCP card or with an expired MCP card to renew it online. Yesterday, we asked anyone who participated in team sports or attended gatherings of more than 10 in the metro area involving students in grades 7 to 12 last weekend to self-isolate for 14 days. As clarification, this applies to events in the metro area, which extends from the tip of the Northeast Avalon, including CBS, Paradise, and all the way to Witless Bay. It does not apply to spectators. Gatherings applies to social gatherings of friends where protective measures would not be in place, such as parties and sleepovers and things like that. A gathering where COVID precautions are in place would not apply, such as a faith-based gathering. If your child is not able to self-isolate away from the family, then the whole family must self-isolate together. And if anyone in the family develops symptoms, you should arrange testing and the entire household must self-isolate. If you are identified as a close contact of a positive case, you should also arrange for testing. And of course, you will be self-isolating. If you are living in a house with someone who is positive for COVID, you should self-isolate until 14 days after your last contact with them or when they are cleared from having COVID if you are self-isolating together. As a reminder, we ask you to please use the online assessment and referral tool to book a test. Only use 811 if you do not have access to a computer. Anyone looking to book a COVID test will be prioritized based on the nature of their exposure and symptom status. It could take up to 72 hours to receive a call to book a test. Eastern Health is prioritizing depending on exposure risk. And we are exploring the most effective ways to use our rapid testing in the metro area and across the province. We are aware that a wide range of organizations and businesses are impacted by the COVID exposure notifications. Given the number of individuals in the region self-isolating, it is inevitable that some of these will be Eastern Health staff. If you are an essential healthcare worker with Eastern Health and have been directed to self-isolate, a line has been established where you can call to get direction from Occupational Health and Safety. If you manage a business where a positive case has been identified, Public Health will be contacting anyone identified as a close contact. Businesses should use Health Canada approved disinfection products and follow the manufacturer's directions. We also ask you to remember that the physical building itself is not where the risk is. The virus cannot live long on surfaces. It is the exposure to other individuals that is the greatest risk. As a recap, for those who may have just joined us, we have 50 new confirmed cases since yesterday's media advisory. The total number of cases in the province is 660. I know there is much uncertainty right now. And remember that we are still in the very early days of this outbreak. Be assured that we have had a year to plan for this, and we are activating those plans. Eastern Health are doing a phenomenal job. I have every confidence in our public health team to guide us through this. We need everyone to do their part and listen to the public health advice. So please stay home if you're unwell, limit your contacts, wear your mask, physical distance. Hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. I will turn it over to Minister Haggie now for some short comments.
Thank you very much, Premier. Day 342 and 50 cases, which is, I think, of concern in many respects, because one of the challenges with this virus is that the case numbers ebb and flow from day to day, and I would hate anyone to assume that simply because today's numbers are lower than yesterday's, that anything should be or could be read into that. As Dr. Fitzgerald referenced, the demand for testing is increasing as she and public health cast their net somewhat wider. 811 have increased staff by just under 40% this week and will go to an increase of about 90% by next week. The first port of call, if you have internet access, should be the online self-assessment tool. That will route your information directly to the appropriate regional health authority, who will then contact you directly. Using the phone should really be reserved for those people for whom the issue is not COVID, or if it is COVID-related, their internet is not up to the task. Dr. Fitzgerald has referenced that if you are awaiting a test or you've had a self-referral already submitted, it's best not to call 811 unless you fall into the categories of MCP number, these kind of things that she's referenced. This simply adds to their workload and bogs them down somewhat. You can also schedule an RN consultation through 811 by yourself using the Healthline app if you put that on your phone. It's a simple process to register, and it can be used for non-COVID related issues as well. And for those people who need it, a prescription refill for routine non-controlled drugs can also be provided by a nurse practitioner for at least 12 hours out of the day. I'd like to repeat again the utility of the COVID Alert app. For those people who have it, it is a great help in recalling for you contacts that you may have had over the previous 2 to 14 days. People who have tested positive are asked if they have the app. If they have the app, they're given a code, and then it's up to them to activate that code. I hope that clarifies some of the confusion I've seen on social media. Our challenge is the uptake has been low, and I see some social media influencers have been out there today trying to promote it for us, and I thank them for their efforts. As regards an update on the vaccine, as far as Pfizer is concerned, we have administered 12,132 doses, which represents 83% of our delivery. And of those, 5,321 have been to people who are now receiving or have just received their second dose. In Eastern Health, all long-term care residents have been done in Metro, and they're working their way out through the rural areas. Once that is done, they'll start on residents of personal care homes. From the delivery point of view, we expect 5 trays of Pfizer, a vaccine, next week, and then the week after. Thereafter, the delivery amounts are subject for planning purposes and not hard. Moderna, we've had 2,855 doses given, and our amount for next week is to be determined, and we should hear about that tonight. They have had some challenges with their supply chain too. Again, I don't think it's wise to let your guard down because you see a dip in numbers so soon. I think only 50 may be misleading in that sense. I would echo what Dr. Fitzgerald has said about Eastern Health, and indeed all the RHA staff who have risen to the task remarkably well. So to paraphrase Dr. Fitzgerald, I would carry on as we are, follow the guidelines, obey the special measures orders, and we will continue to work our way through this. So with that, Premier, I'll hand it back to yourself.
Well, thanks very much, Minister. I'll now open it up to questions from the media.
Thank you, Premier. For the benefit of our speakers, there are 8 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are from Elizabeth Whitten with All Newfoundland Labrador. Please go ahead.
Thank you. If you're starting to see more cases in Central Health trickle in, is your focus still on clamping down on just the St. John's Metro region to contain the surge?
So the cases in Central Health are under investigation, so the source has not yet been identified. We may find out that the source can't be identified, and certainly that would be concerning for us. But we're certainly, Central Health, is working through that right now, and so I don't have an update to give you there, but we're certainly concerned that we could be seeing some cases popping up elsewhere. However, we don't have confirmation that that is the case at this point. We certainly have seen contacts in other areas, and so we hope that we've captured those with the advisory that we put out yesterday.
Thank you. And previously, you've discouraged non-essential travel into and out of the St. John's metro area because people could be spreading the virus. But can you give a bit more of a definition of what exactly essential travel entails?
So I would call essential travel what you have to do for your livelihood, for your health. If you have a loved one, a family member who requires your help urgently, those sorts of things. I think, for the most part, people really understand the meaning of essential. It's something that has to be done, that can't be avoided, it can't be delayed. And so, those are the three things that come immediately to mind for me.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
I have a question about the new long-term care restrictions. We just heard the minister say that we now have all residents have been given the vaccine for long-term care homes. If someone has both their shots and they have that immunity, why aren't we then allowing them to continue to see visitors, especially since we know how important that personal contact can be for seniors?
So the majority of people in long-term care don't have the second dose. There are some in Eastern Health that have the second dose, but most don't, so they have one dose on board. So that's one reason. We also don't know exactly what effect this the vaccine will have on transmission from person to person. So we're still trying to find, that information will only come as we use the vaccine and as we see the difference in transmission rates with vaccine versus without the vaccine in a setting. So that's going to come along as we have more experience with it. So at this point, we are, there's still a lot of information that we have to have about that. And so we're being cautious just to make sure that, we reduce the risk as much as we can. But as I said, I hope this will be short-lived and that we'll be able, once we get things under control, we'll be able to open up to visitation a little bit more.
We're seeing businesses outside of the metro area putting in restrictions saying if you've been in the St. John's area in the last 14 days, we don't want you inside our business. Can you give us an idea for someone who is not part of the isolation requirements that you put in place, but maybe just has been in the St. John's area in the last 2 weeks? How high a risk are they, and should businesses be putting in these sorts of restrictions?
So I think, if you've traveled in here, obviously we're saying only essential travel, so we do feel like there is a somewhat higher risk if you are coming into the metro area at this time. We know we have community transmission, and we don't know yet the full extent of that. We're still, finding that out as time goes on. So while there is a slightly increased risk, we know that as long as people, when they are here, if they're following public health measures, maintaining physical distancing, washing their hands, wearing their masks, and then if they have any symptoms, they're isolating and getting tested, then you're going to reduce the risk of spread. When they go back to their hometowns or whatever the case, then again, they follow those same public health measures of wearing the mask, physical distancing, washing your hands. Get tested if you're feeling unwell, if you have any symptoms at all. So all of these things help to reduce your risk, and there are still some things that are essential that you have to do. So hopefully they'll be able to avail of those services if they need to.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Good afternoon. I have a question about the provincial courts. Apparently, they have not changed their procedures this week. They have youth appearing in person. Some staff are having to isolate. They still ask if you have 2 or more symptoms. Is it not time that they go back to virtual proceedings, in your opinion, Dr. Fitzgerald?
If the courts have any questions about any questions about public health measures, they certainly know they can reach out to our team, and we'd be happy to provide any input to them. But I'm not sure what the processes are, and I certainly wouldn't want to comment based on what we're hearing from places other than the courts themselves.
Okay, thank you. And numerous people have been asking what locations beyond the Northeast Avalon that cases are recurring. We used to have that kind of breakdown on the hub, but it was taken down. Is that for a reason?
So it's mainly for privacy reasons. You know, there are lots of places that are very small, and so it sometimes is easy to know who a case might be just because of where they're from. So it's really just about maintaining privacy. At this point, you need to assume that COVID is around you. It doesn't matter where it looks like it is on a map. Assume it's there. Do what needs to be done. Knowing that it's in place A or place B is not going to protect you any more than doing all the things that you need to do to protect you, to protect yourself and your loved ones. So that's what you need to do, and not worry about what's on a map.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Yesterday you had noted for the grade 7 to 12s in regards to gathering being from February 5th to February 7th. Getting a lot of questions about this. On the 5th, which was a school day, would not have been going to class considered a gathering?
So we're really thinking about more those social situations where they're interacting and maybe not using, those public health measures that we recommend people use. So, and, in classrooms, generally people are sitting, they're spaced apart. So really we're talking about those social gatherings that people were attending, I should say.
Thank you. And another thing we're looking for clarification on, be self-isolating. A lot of people now having to go get tested or have been at places that have had advisories out. Do you need to I know yesterday you had said you need to self-isolate until you're tested. Do you still have to self-isolate after receiving a negative? What's the protocol here for family members in the home if you're not having to be tested but are self-isolating?
So what's the protocol? Sorry, Kellyanne, I lost you there. What's the protocol if...
All good. I'm looking for the protocol around self-isolating. After I receive a negative test, do I still need to self-isolate? If I don't need to be tested but need to self-isolate, what does that mean for my family? Just some clarification around this. Okay, so if you have been contacted by public health and they tell you you're a contact of a case, then you have to self-isolate for 14 days regardless. So that's, and it doesn't matter if you have a negative test. They'll arrange testing for you, but it doesn't matter if that test is negative. You still have to self-isolate for 14 days. If you've had a significant exposure and you're tested, so if you've been somewhere where you may have been exposed to, say, your work exposure, for example, we would still consider that a close contact in many cases. So you would be advised to self-isolate until for the full 14 days. If you are symptomatic but have had no exposures and you get tested and you have a negative test, then what we're recommending is that you have to stay home until you have a negative test and your symptoms are gone for 24 hours without using fever-reducing medication. And if you're part of an advisory and you've been advised to get tested and your test is negative, then you need to monitor for symptoms. Thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you, Dr. Fitzgerald. With the huge spike in cases that we're seeing, how prepared is our healthcare system to deal with possible hospitalizations from the situation?
So my area of expertise doesn't fall to acute care, but my understanding is that all the RHAs have certainly been looking at these things, and they have been arranging that, but perhaps the minister would be better placed to speak to that.
Yes, I meant to ask Dr. Haggie, sorry.
Thanks very much, Richard. It's a good question. We've been in contact on a very regular basis with each of the RHA CEOs, particularly Eastern Health. Eastern will be reducing further some ambulatory outpatient services, as much to enable staff to be redeployed as to reduce the traffic through the facility. There are beds and staff identified for management of COVID-related admissions. You remember that the staff on the COVID unit, because of logistical issues, were actually the first in the province to get vaccinated, along with some of the public health staff. Other regions have their own COVID unit, their own COVID protocols, and their staff too, for those specific COVID-related areas, have also received the vaccine. So I'm not advised at the moment that there is any concern that demand for inpatient services can't be met. I think Mr. Diamond and his team, particularly in Eastern Health, are working really hard to make sure their public health and lab staff are supported at the moment, and that's their prime focus.
Thank you. And Premier Fury, does the government right now have the financial ability to help those who are currently out of work or who may be out of work for some time due to the outbreak? And are we looking at any of those options right now?
Thanks. We are looking at all options available to us. There was a COVID relief fund in place, and we're certainly discussing that with the Deputy Premier and the Minister of Finance, as we know that this will go into the future.
Thank you.
Our next questions are from Roger Bill with iPolitics. Please go ahead.
Dr. Fitzgerald, on Wednesday, when there were 53 cases, I asked you what you thought the number would be on Thursday, and you replied, you said you didn't think it would be any less. I think if I'd asked you yesterday, after the number was 100, what you thought Friday would be, I wouldn't be surprised if you would have said, I don't think it's going to be any less. In fact, he came in surprisingly lower, which I would think you must be very pleased. But what do you read into the fact that the number for today is significantly lower than yesterday?
I don't read anything into it at this point. It's just, as the Premier said earlier, these numbers will fluctuate. They'll go up and down. It's a function of not just how many tests we're doing, but who we're testing. So, you know, we recognize that in Mount Pearl Senior High, we had a lot of close contacts. We had a lot of people who were symptomatic, and those were priority testing. So our testing in the beginning phases were focused on that high school and the students in that high school. We expected to find a lot of cases there. And now our testing, you know, we're moving away from that. We're testing in other areas, so we're not finding quite as many. But as time goes on, you know, if these people have lots of contacts, we may find a whole lot more cases as a result of that contact tracing. If we start to see, the other thing we have to remember is that, you know, we're thinking that this past weekend was a big time of exposure, that there was a lot of spread this weekend because of social activities, sporting activities, that sort of thing. So we're about 5 days out from this weekend now. So 5 to 7 days, that's when we start to see people become symptomatic. So we actually might see a whole lot more cases over the next 2-3 days. So we really can't read anything into these numbers right now. We have widespread community transmission that has not changed since yesterday. We need to continue to live as if we do. So, yeah, I would not read anything into it.
And just one other question. I don't know if it was mentioned or not, but have there been any hospitalizations out of these first, what I think is 247 this week?
Nope, not to my knowledge at this point. There's been no hospitalizations.
Thank you.
Our next questions are from Ross Lord with Global News. Please go ahead.
Hello, and thank you, Roger, for asking the hospitalization question. Related to that, what, if any, indication do you have about the presence of variants? I think you mentioned you might know that today.
Yes, so we don't have, we sent off several specimens urgently to the lab. Many of our specimens, if not all of our specimens, positive specimens go to the National Microbiology Lab to be tested for variants, or whole genome sequencing, I should say. And that's the process that will find variants if we have them. We sent several of this cluster off urgently to try to get results. We were told that the turnaround time was about 48 hours, but of course, as you are aware, variants have increased across the country, so I'm sure most everybody is sending their specimens to the National Microbiology Lab. So, we were hoping to get them today, but it could be later today. But we haven't had them back as of when I came over for the media briefing. So.
Okay. And I was looking at some new indications about, related to what you said, if I heard it correctly, about you're starting to see cases outside the Avalon, if I heard that correctly. The community of Burlington saying it's closing all municipal buildings and announcing that Town Hall will not be used as a polling station because of what it calls COVID throughout the province. What concerns do you have about COVID interfering or possibly spreading more widely because of tomorrow's elections in those communities?
So at this point, we have evidence of contacts. Sorry, if I said cases, I apologize. Contacts elsewhere. And we do have a couple of cases that we're still investigating in Central. Right now, though, we know that if we are able to maintain those public health measures, if people physically distance, if they maintain their distancing at the polls, if they wear their masks, and they don't go out if they have symptoms, if all of those measures are in place, we can safely conduct an election elsewhere in the province.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Hello. First question is related to daycare services, regulated or not. Are they remaining open for all people, not just essential workers?
We are asking that daycares remain open because we do need to maintain our essential workforce, right? Especially our frontline essential workforce. So we ask that if you don't have to send your children to daycare, if they can stay home, then you should do that. And that, as much as possible, children of essential workers that have to go to work, that have to be physically present for their job to be done, that those daycares, that those children be the people who are in daycare.
Sure, but I meant for other people who aren't essential workers.
So we're asking that they not bring their children to daycare as much as possible, so that we can reduce the number of children that are in daycare.
My second question will be for you, Mr. Fury. The Elections Commissioner, Mr. Chalk, said this morning that parties will be given guidelines on how the campaign can operate over the next 2 weeks past the initial date for the election. Can you tell us what you know about how the campaign is going to have to continue and what rules you have to follow?
I have no knowledge of that yet. We're still waiting for an update from Elections NL.
Thank you.
Our next questions are from Elizabeth Whitten with All Newfoundland Labrador. Please go ahead.
Thank you. Minister, I'm wondering, have there been any updates on how many healthcare workers are self-isolating or have been tested positive?
Certainly, I can give you the figures on isolation. I'm not aware of the numbers of positive individuals in the healthcare system. I am aware of one, certainly recently, but that individual was not a risk because they hadn't worked during the infectious period. In terms of isolation, by breakdown, we have 233 in Eastern Health, 35 in Central, 8 in Labrador Grenfell, and 24 in Western as of this morning, for a total of 300.
Thank you. And with all these special order measures and restrictions, I'm wondering, have there been any infractions reported?
Probably best for you, Minister.
Yeah, we certainly have the COVID form online. There has been a steady trickle of complaints or concerns brought to us over the course of the entire pandemic. I'm not aware that this has spiked recently, but I can certainly go and find out what the data is, say, for this week compared with previous weeks. I don't have that to hand, but I can look for that.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
I've got a question about rapid testing. I was told that that's been discontinued. Nova Scotia ramped up a lot of rapid testing, especially for asymptomatic people when they were dealing with their outbreak. So can you give me an idea on how it's being used right now and why we aren't using it, for example, for all of those people who are at parties and sporting events to be able to allow them to get tested rather than just isolate?
So we were using rapid testing at the Mount Pearl site, we got through a lot of the senior high students who were at our highest priority, to some degree, it was new. It's a new program. We were working through things to some extent, and it was felt in the end that the value add wasn't there. We have looked at now how we can use it differently, and that is I was in a meeting just minutes before coming here, just about how we can do that effectively, so that we can use those tests to catch as many cases as we can, to interrupt chains of transmission as much as we can, and to not get or to have a lower risk of false positives and false negatives. These tests, the ones that we used in our Mount Pearl site, certainly all of the presumptive positives, all of the tests that were positive on the rapid antigen test did turn out to be true positives. But as with any of these tests, there were some false negatives. So we have to look at that. We have to use it in the right population to make sure that, we're not increasing the risk of having a false negative out there. So we're really looking at that right now, and which situations would be best to use it in, how we use it, how we combine it with other testing, confirmatory testing. So those are all questions that we're working through right now.
I want to ask about the demographics of the cases that we're seeing. Yesterday it was 3/4 young people. It's now kind of shifting. We're about half. Should we read something into that shift, or how concerned are you that we're now seeing the cases sort of spread out from that core group of young people into some of their close contacts?
So I think part of it is that we're just testing a different group of people now. As I said, we were prioritizing testing. So our first priority were those students in the school, and so we were seeing a lot more young people. Now we're moving our testing to their contacts, and then any other positive cases that we may have, we're prioritizing those. So I think for the most part, it is a function of who we're testing at this point, who we've prioritized for testing. But it's going to take a bit of time, really, and really we're going to be probably closer to the end of this outbreak before we can really look at truly what the demographics are once we sort of get through the worst of it.
Thanks.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hi. Has the source been given for the one case in Western Health yesterday?
The one case in Western Health, it was travel related, is my understanding. Okay.
Thank you. And the other question, Mr. Haggie, you said earlier in the week that you handed out, I think, Eastern Health handed out 15 codes for the COVID app. Why so few?
The only assumption I can make is that those were the numbers of people who, when they had the results, were asked if they had the alert app, because everybody gets one if they have the phone. Whether they choose to use it is up to them, because we can't mandate that. We've no way of accessing their phone. This app was built with the core principle that personal privacy would be protected while still being able to supply a spread out distributed alert system. Of those 15, 12 have used them. I'm not in a position yet to analyze the whys and wherefores of that, but currently we don't have any data, for example, from nationally as to how many downloads of the app have been made within this province, because again, that initially hasn't been collected because of privacy concerns. There is some discussion that might become available in the not too distant future. But that's the best I can answer that with at the moment, Peter.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. We've had some pretty nasty weather this week, and very thankful for all the public health workers enduring it. But are we looking at ways to, tent some of these testing sites or move them to areas where they're maybe not exposed to the conditions outside as much?
Minister, do you want to comment on that?
Yeah, I was just about to do that. Thank you very much, Premier. The short answer is yes. I mean, the sites at other locations are, if you like, pre-existing. The one in the parking lot of Mount Pearl Senior High was basically put up in 24 hours. So I think the concern there is how one can make that a little bit more weatherproof over the course of working, round the clock. Well, not quite round the clock, but certainly for 12 or 16 hours a day. So I think that's with Eastern Health at the moment. But it's certainly a concern of ours. And in addition to PPE, they certainly need to bring their thermals with them this week. And I thank them for the effort. It must be difficult.
Thank you. And I'm not sure if I missed this earlier. I think we spoke about not listing the specific communities with cases. But 2 days ago in the advisory, there was a list of businesses with potential dates and times of exposure. Is Public Health looking to continue doing that and seeing that other businesses and seeing alerts and it's running over social media? Just wondering if Public Health will be releasing them.
So if we feel that there is a significant risk to people to release the information, then we will. And often it's very difficult to find people any other way than to make a public advisory. So we will do that if the balance of protecting the public outweighs privacy issues for the businesses. But we hope that we won't have to do that for much longer, as people are moving around less and going out less. So if we're all doing what we need to do, we shouldn't have to rely on those types of advisories for much longer.
Thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. Public health resources have been obviously very tied up in dealing with this outbreak. How does that affect our ability to administer vaccines in a timely and safe manner? And when can seniors 85 plus have access?
So my understanding is that vaccine administration is going ahead in Eastern Health, and vaccines can be administered by lots of professionals. It doesn't have to be Public Health who does that. I know traditionally with our childhood vaccinations, Public Health certainly are heavily involved in that, Public Health nurses. But in long-term care, for example, we have trained nurses who are able to give vaccines, so that they would be the ones who would do that. So there are certainly contingency plans in place for how we would give vaccines. We knew that at any point during the period of time when we were giving vaccines, we could have a surge of cases, and that Public Health would be taken up doing contact tracing. So those plans are in place for how to do that.
Thank you. And all residents and staff at the Valley Vista Seniors Home in Springdale are being tested for COVID-19 following a confirmed case in that region. How widespread is this outbreak, and what can you tell us about it?
So all I know at this point is that we have the one case, it's not widespread as far as we know. Everyone has been tested. They're employing rapid testing with the Abbott ID Now out there, so that they can get those test results very quickly to find out if people are positive. They're getting confirmatory tests here at the lab, But, because of the significant amount of testing that's been done, being done here in Eastern Health, we felt that the best thing to do would be to have rapid testing deployed out there so we can get quick answers. And to date, I'm not aware of any residents who have tested positive, and they're following strict public health measures.
Thank you.
Our next questions are from Roger Bill with iPolitics. Please go ahead.
Dr. Fitzgerald, I don't know if you have time in your schedule to watch television news in the evening, but last night there was an interview with one of the owners of the Bannerman Brewery, the pub at the old fire hall on Duckworth Street in St. John's, about the impact of the lockdown we're experiencing now. In the course of his answer, he said, I think, as an expression of respect for you and gratitude that I think he believes people owe you, he said, Dr. Janice Fitzgerald should never have to buy a drink in Newfoundland, ever.
Hear, hear.
Well,
So,
if Dr. Janice Fitzgerald drank much, I guess that would be. But she doesn't, so.
I want to ask you, it's not an issue question, but you're on the television every day. You're in people's homes. People feel like they know you now. I'm just curious, do your kids ever critique your performance? I don't mean by performance that you're performing, but you know what I mean?
My kids don't watch it. They do not need to see Mom on TV, that's for sure. So, no, they really don't. I'm not kidding.
You're old enough now, maybe they're at Bannerman Brewery taking you up on the offer.
They might throw my name around to try to get a drink. I don't know.
Anyways, I think Ross Lord's next.
Thank you. Ross Lord from Global News. Please go ahead.
Okay, thank you. Just confirm, Premier, that there is no other availability with you today. So I'm going to ask you this. How much concern you have over this two-stage election, protracted election, and how much risk that the long amount of time between day one and day two could mean voters are making decisions based on different information, possibly tuning out, and the prospect of things like low turnout, which in turn could force a legitimacy crisis of sorts. Are you concerned about those sort of wildcard variables, or are you just content to let this play out as it will?
Well, the wildcard variables is something I'm sure that Elections NL has weighed. It'd be inappropriate for me to weigh in on trying to influence what Elections NL could do in the future or currently. Right now we have a solution. It's a different solution, but these are different times.
Thank you.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Sort of a question in the same vein. There's been a number of people who have taken to different airwaves today to talk about issues regarding the legality of these elections, the potential of Mr. Chog or the Elections Commissioner having acted potentially outside of his authority. Is that a worry for you, Mr. Premier, going into the election tomorrow? And is there any consideration in terms of measures? There's been ideas of, floating, recalling the House of Assembly to make sure this is all legal. Is that something that has been considered?
Look, it would be inappropriate and undemocratic, irresponsible for me to try to influence the democratic process, and that's Elections NL's call.
And to follow up on that, yesterday in Mr. Chalk's letter to yourself and the other party leaders, he suggested that the leaders speak with the Lieutenant Governor on this. Has anything like that happened? Has there been any discussions with their office?
His subsequent letter provided options for people to vote and vote safely, and I believe that that's the best path forward now. But I'd like to remind everyone, Dr. Fitzgerald's time is very valuable, so if we could keep this focused to the public health issues at hand, that would be great. Any elections issues at this point should be directed to Elections NL.
I'll now go back through each reporter to see if you have one final question. Elizabeth Witten with All Newfoundland Labrador. Do you have a final question?
Yes, I'm curious, Dr. Fitzgerald, do you have an estimated date in mind when you expect to have an idea if the circuit break has worked? Like, is there a milestone you need to see in the numbers or the epidemiology to think, okay, this is working?
I think we need to see a consistent downward trend over a week to 2 weeks, and we'll see what happens in the coming days. But time will tell. Like I said, these numbers right now could go up and down, so it's really too early for us to make any prediction at this point.
Thank you.
Peter Cowan with CBC. Do you have a final question?
I do, and it's about the alert levels. Dr. Fitzgerald, you said we're moving away from those, but if I look at the COVID website for the government, even the graphics that are used for these briefings, it continues to say we're in alert level 2. The alert level information is all over the website. People reaching out to me say they're kind of confused by this. Other areas like New Brunswick continue to have regional restrictions while still having some sort of level system. So why can't we do something like that here?
So I think the bottom line is we just need to do what we need to do, and we can put in special measures orders. We can have those very focused. We can have those localized depending on what we see as the source of transmission for an outbreak, for example, right? So if we had something like Halifax had, where they were seeing a lot of cases that were coming from, the bar and restaurant scene, then we would focus our measures there. Now, we recognize right now that we have widespread community transmission, and that's a little bit different. We do have to be a little more broad in our measures, but there may be, at times that we don't need to do that. And so to say, when we were putting in those alert levels, we had sort of closed everything down at the beginning, and the alert levels were used to sort of help us open things back up. But there may be some things that we need to close that would be, closed in one alert level, but other things that were in that alert level could remain open. So it's very difficult to just make a blanket move to the alert levels. And, I think quite honestly, we've just been quite busy over the last couple of weeks, and to think about updating the website in that regard, other than important public health information right now that people need to stay safe, is just not on the priority list.
Okay, thanks.
Peter Jackson with The Telegram. Do you have a final question?
Just a short one. What percentage of COVID-19 cases in this province are you aware have been asymptomatic cases?
Peter, we do have that information, and I can certainly get it for you. I certainly wouldn't want to speak out of turn, so we can certainly get that information for you if you want to follow up.
Okay, thank you.
Kellyanne Roberts with NTV. Do you have a final question?
I do. Dr. Fitzgerald, when it comes to testing, we know that there is a lot of people looking to get tested right now. How long should it take approximately for people to receive the results of a positive test?
So if there's it depends on a couple of factors. It depends on the turnaround time at the lab, so how long it takes for this, once the specimen's been taken, to actually get to the lab, get tested by the lab. That certainly could be in the range of 48 to 72 hours at this point. But as soon as, as public health knows about a positive case, as soon as they can get on that, they will call people back as quickly as possible. So the negative test will be available on the website. So you are able, if you have an up-to-date MCP, you can actually go in on the website and get your test. You can check for your test results, and negative test results will be posted on that.
Thank you. And I just want to add, I'm getting a lot of messages, and I feel it as well, but we all just want to say a big thank you. We know that this has been a stressful week for you, so thank you for what you do.
Oh, well, thank you, Kellyanne.
Here, Kellyanne.
I have to tell you, I've received a lot of, I just need to say this, I've received a lot of thanks and praise and gifts over the last few days, and I do want to say thank you to everybody for their kindness, but I am one person. There is a huge team of people behind me, and there is no way I could get up here every day and do what I do without that team. and not just here at the department, but the teams that work in all of the regional health authorities. And Eastern Health is the focus this week, but they've all stepped up intermittently over this pandemic. And what Eastern has been able to do in this past week is nothing short of phenomenal. And we all owe them a huge debt of gratitude for how much they're working to keep us safe. And that's from the people who are putting those swabs up other people's noses to the administrators who are working tirelessly to make sure that all of the processes are put in place so that these clinics can run smoothly. So my hat's off to all of them. We all owe them a very heartfelt thank you.
And Kellyanne, she's being a bit humble. We're truly lucky to have Dr. Fitzgerald's advice and guidance. She's gotten us through this far and will get us through the rest. We'll get out the other side.
Thank you.
Richard Duggan with BOCM. Do you have a final question?
I do, and I would like to echo Kellyanne's thanks to Dr. Fitzgerald and all healthcare professionals, especially over this last week. What's the plan right now in terms of doing these live updates over the weekend?
It's our intention to do one tomorrow?
Yes.
It is.
It is? Okay, perfect. Thank you.
Roger Bill with iPolitics. Do you have a final question?
Yes, I do. Dr. Fitzgerald, how big or little is your immediate team, your office?
Our team at the department, I think it fluctuates somewhere between, before the pandemic, our team is about 9 or 10 people generally, and during the pandemic that expanded to 15 or 16, and now I think it's back somewhere around 10 to 12.
Thank you.
Ross Lord from Global News. Do you have a final question? Ross Lord, are you still on the line? Okay, we'll move on to Patrick Butler from Radio Canada. Do you have a final question?
I do. Question for the Premier. Just following up on your statement about Dr. Fitzgerald's time being important and this being a briefing about COVID. Just a question for you on that. I mean, if this is a briefing solely about COVID and the public health response, then why is it important for yourself as Liberal leader during this election to be present at these briefings?
Well, as we've said throughout the week, even in a caretaker mode of government, as per the parliamentary procedure, there's still a premier and there's still a cabinet. And in difficult times like this for the people of the province, and I understand they're difficult for people and their families, I think it's important that the Premier and the Minister be here to support and give support to Dr. Fitzgerald and her team and the rest of the people of the province.
Thank you, everyone. Premier, do you have any final comments today?
I would just like to thank you all for joining. Again, don't read too much into the numbers today, but I would also like to echo some of the comments that have been made towards Dr. Fitzgerald and her team. We communicate several times a day, and I know how busy she is and what incredible stress and strain she's under, but an incredible, mighty team behind her. I'd also like to recognize the people at Eastern Health who are doing just a tremendous job, some of my former colleagues and friends on the front lines, and administrators who are just doing a phenomenal job. And I'd like to remind everyone just to be kind to one another. You know, if we look after each other, if we all do our part, we will get through this. So be safe and take care.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.
Our smartphones. We use them to keep in touch, to play, and to work. Now, your smartphone can help you limit the spread of COVID-19. Someone can have COVID-19 and not know it. They can spread the disease before they have any symptoms. The Government of Canada has developed an app that will let you know if you may have been in contact with someone who has tested positive for COVID-19. The COVID Alert app creates a random code so that no one will know your name or your location. The app uses Bluetooth to exchange random codes with nearby phones. The code is a randomly generated string of digits and letters that changes every 5 minutes, so it cannot be used to identify you. The app does not have access to your name or address, or your phone's contacts, your location, or your health information. If someone you've encountered later tests positive for COVID-19 and uploads to the app a one-time key they received from their healthcare authority, you'll be notified that you may have been exposed. If you test positive for COVID-19, you can upload your one-time key from your healthcare authority. The app will then notify the people you've encountered without revealing your identity. You can then take steps to limit the spread of the disease.